and that about 15% of this number is not going to make it out of the hospital alive. So very sad things we're looking at going into the future. If we look at age groups, we are seeing some different trends, and I think not very surprisingly, we're seeing a pretty rapid uptick in the people who are between age 5 and 17, as it correlates with school getting ramped up. And and we were actually going up after 4th of July holiday, but this number is going to continue to increase because we've got a lot of cases in the school setting right now, and currently over 20,000 kids are quarantined because they've been exposed to coronavirus. One of the things that's good is you can see the pretty steady drop in people who are 65 and older because they've been vaccinated and they have a lot better protection than other age groups. But also we're seeing a steady increase in the percentage of our cases that are in, basically the toddler and the infant group. Another curiosity we've seen recently is an increasing proportion of cases in Caucasians compared to African Americans. We have noted sort of anecdotally that the African American population has really embraced with safety procedures a lot more vigorously. When we've talked to Black leaders, faith leaders, community leaders, there seems to be a lot more unity in some of the preventive measures as far as keeping COVID away. But we are making progress on multiple fronts with the vaccinations for everybody. One of the things that, if you don't remember anything else this whole time, please know that the vaccinations are making a huge difference for those who've gotten them. The problem is not enough people have been vaccinated. You can see that 98% of all of our new cases are in people who are not vaccinated. Now, without a doubt, I know people who've been vaccinated who've got it, but it's really a small percentage compared to this. One of the things you're going to see is you're going to see 40 and 50-year-old people probably who've been vaccinated who get sick, but they're going to be mostly protected. They're not going to get as sick and much less likely to go in the hospital or die. But this is a huge number of young folks who are not vaccinated who are really driving this number. 89% of our hospitalizations are unvaccinated and 86% of our deaths. What we're seeing is a lot of cases in this specifically younger and adult age group is then spilling over into older folks who have weaker immune systems and maybe didn't respond as well to the vaccine. That's one of the reasons why we're looking at doing boosters now, booster doses. Of these 14% that are vaccinated folks who have died, the average age is 78, and over half of them have severely weakened immune systems because of a variety of medical conditions. You can see that our hospitalizations are pretty dramatic. And if you look at in recent days, 93% of our people who are in the hospital right now are in unvaccinated folks. And without a doubt, our hospitals are overwhelmed, and you may have seen that we've actually had to open up 2 different tent hospitals to try to accommodate the number of folks who are coming into the hospital. You can see that we've got a record number of people in the hospital with COVID, and then a record number of people who are in ICU who are on life support. Keep in mind that of this number, about 15% of them, sadly, are not going to make it out of the hospital. About a third of these people are not going to survive, and about 2/3 of these folks are not going to survive. So very, very tragic what we're going into in the near future. You can see our available ICU beds are declining very, very quickly, and we're under extreme duress. Most of our hospitalizations are now in the age group of people less than 50. So that's been that's been quite a difference. If you see people under 50 were a lower percentage through all of the pandemic until the summertime, where it's really skyrocketed. And that speaks in large measure to the small number of folks who are vaccinated in these age groups. And you can see that we've had a lot more kids in the hospital. And we have 6 kids right now who are in ICU and 4 who are on life support. And then, that's pretty much all I wanted to share on the slide bit, but just want to make sure everybody kind of understands where we are. We're in a really sort of delicate part of the pandemic right now because we have an under immune population, either because of natural infection or because of vaccine. We're seeing a wildfire, and it's all because of the Delta variant. The Delta variant is way more contagious than what we had last time. It's about 3 times more contagious than what we saw last summer. We were doing pretty well in May and in June with the older variants, even the Alpha variant, which is a little bit more contagious, because we had probably just enough immunity to maintain a steady state of transmission. But now with this Delta variant, we're seeing just a skyrocketing cases and deaths. And I'll tell you, some of the tragedies are really starting to unfold, and I suspect a lot of you are starting to see them. I mean, every death is a tragedy, but we're starting to lose kids. We lost 2 teenagers in the past several weeks. Healthy kids by and large. just normal kids who got COVID. We know that most kids will get over it, but if a whole lot of kids get it, we're going to lose some kids, or they'll end up in the hospital. So we're going to have more tragedy. The other thing is we're seeing more and more sort of young adults who have young families who are not making it. People in their 30s, people in their 40s, people who are healthy or maybe just a little bit overweight are the only medical conditions that they're having. Our some of our fastest growing death age group is 40 to 49. Again, almost entirely unvaccinated. We know that if you're under 40, we don't have a single death in a vaccinated person, but a lot of deaths in people who are under 40. I'll just give you a couple of just kind of sad stories. I think sometimes it speaks to really what's going on. My wife runs the ICU in Laurel, and it's been heartbreaking because previously she'd be meeting with women in their 60s, maybe 50s, whose parents had died, and that was very tragic. But they were 70s and 80s, and it wasn't quite as unexpected, even though it still was a tragedy. But now she's meeting with some of those same moms, and they're burying their children, their sons, who a lot of times the moms are begging them to get vaccinated, and the sons will say, or even the daughters will say, I'm young, I'm healthy, I'll get over it, and they don't, and they're not going home. It's a little bit like playing Russian roulette with a 1 in 50 chance of dying. And why would you do that when you could make it pretty much zero by getting vaccinated? And that's the challenge that we've seen. I know that it's become kind of a contentious issue with the masks and the vaccines, but absolutely the vaccines are safe. There's a lot of lies out there. They're very effective. Are they perfect? No, but we never expected them to be perfect. The other thing is I just want to mention to you guys is if folks get COVID, we're strongly encouraging them to go ahead and talk to the doctors about monoclonal antibodies. Monoclonal antibodies, it's basically an antibody cocktail that you can get an infusion or an injection, and it basically will cut your hospitalization rate by 80 to 90%, and it'll lower your death rate substantially. So if you get COVID, pretty much anybody who gets COVID needs to think about getting antibodies to kind of keep them from getting sicker, because we are seeing this sort of tragedy. And the last thing I just want to mention is the booster doses. We do know that over time, the antibody levels from the vaccine they'll fade, they'll wane. And this is the same sort of thing we see with flu shot, right? So we get a flu shot every year. And same thing we see sometimes with tetanus shot, you have to get a booster from time to time. And with the COVID, especially with the new variants out there, this Delta variant, we are starting to offer booster doses for people who have weak immune systems because we know that they don't respond very well. But then probably in the coming weeks, anybody who is 8 months or out from their previous doses will be eligible for a booster dose. And a booster dose is just additional dose of whatever you had before. It's not a new type of vaccine. It's the same thing you had before. So that's really all I wanted to just kind of lay out there for you. I figured we'd have a lot of questions and wanted to leave plenty of time for that and not get you guys off schedule. So at this point, I'll be happy just to take any questions or comments.
Okay, so we have 7 questions for you. The first question is from Joy Foy. Her question is, does the vaccine change one's DNA? She says she's been hearing a lot about this, and that's why some people are not getting the vaccine.
That is absolutely not true. It is not true. None of the vaccines change your DNA. This is one of the things people say just to scare folks. There is a small group of vocal anti-vax deceivers out there who are confusing the broad number of folks. Go back and look at your biology textbooks from high school or college, and you'll notice that mRNA is a normal thing your body uses all the time. It uses it to make proteins. It chops it up right after you use it, and it has no impact on your DNA. Absolutely not true.
This question is from me, Rolanda. How often do you suggest people take the vaccine, the booster dose, if they're not at risk?
So, probably what's going to be happening is we'll be given a booster dose probably for everybody in September, if they want it. We think it makes a lot of sense. And then it just depends on how it plays out. There may be a booster dose every year, like the flu shot going forward. So, just kind of stay tuned. But for now, we think a booster dose is going to be pretty much for everybody within the next month or so.
Okay. This one is from Kathy. When do you think children will be given the vaccine, and what age group will be the first group?
So, right now, 12 and older, can get vaccinated. So really want for kids 12 and older to go ahead and get it because we know how important it is. I do want to say very clearly that the vaccines do not cause infertility. This is another insidious lie spread by folks who have sort of anti-science disinformation agendas. In fact, COVID itself is very harmful to reproductive health. We know that it very much increases the risk of stillbirth, of preeclampsia, of death in pregnant women. So COVID's very bad for pregnancy, and the vaccines are good. Now, the other thing is with the kids, we don't know, but probably maybe September or October, maybe for 8 to 12, they may be available.
Good. I'm excited about that. So yeah, because I have kids in that 8 to, well, I have anyway, I have some kids in that age group.
Good.
Okay.
Good.
Okay, so the next one is have there been any findings with kids having heart complications from getting the shot?
Yeah, so we do know that there's a rare condition where kids will get what we call myocarditis, and it's basically inflammation of the heart muscle. We have had 4 cases in Mississippi, and what the kids happened is they had some chest pain. They went to the emergency room, and they had evidence of inflammation of the heart muscle, but it was mild and it went away. You can be allergic to any medication, and this is kind of the allergy we see with the mRNA vaccines. But all the kids have been fine. And actually, most of them were young adults in their 20s. Honestly, they weren't even kids, which may make people more comfortable. But please know that coronavirus itself does cause heart inflammation at a rate much higher than that. So coronavirus is just really bad for you. We got to quit thinking that it's just a normal cold or the flu. The flu doesn't kill 2% of the population. It doesn't kill 11% of everybody over 65. It's something different, and Delta is even worse than what we've been dealing with before.
Okay, this one is from Daniel. Do people still have to quarantine after leaving the country?
No, I don't think so. I don't think you have to quarantine anymore after leaving the country. The worst place to be right now is in the United States. So probably they should quarantine us when we leave.
Okay, so this one is from Diane. We just answered that one about the complications. Darlene, we've already answered that one, right? Okay, so yeah, her question was, she has a 12-year-old and she was wondering, has there been any complications with children?
Yeah, except for that rare heart thing, but and mostly it's almost entirely boys, but it's mild and transient. Both of my kids, I got an 18-year-old and a 25-year-old, and they are vaccinated. And as soon as they could have got vaccinated, and I'd do it again, and I'd do it again. We lost a teenager this week. Vaccines haven't killed anybody in Mississippi that we know of. When we investigate them, I'm not saying it's not, someone's not gonna have an allergic reaction or something that might not ever happen, but COVID's killed about 8,000 people. So the vaccine, and if you get that COVID and you've had the vaccine, your severity of illness is far, far less.
Okay. And we have one from Tim. He wants to know, what is the percentage of medical staff that has not gotten a vaccine?
It's different in different places. About 96% of the doctors have gotten it. So the docs are all behind it. And in a lot of hospitals, it's like 99 to 100%. The nurses have dropped off a little bit. They're probably closer to about 50%. And I think part of it, we know for sure, is this fear around the myth of the infertility. And so we're really trying to push back on that, because a lot of our hospital staff are women of reproductive age. It's just not true. But once you get a fear out there, it's hard to draw it back. The fear mongers have done a pretty good job of undermining our efforts as far as protecting folks with vaccine, unfortunately.
Okay. Do we have any other questions? Somebody? Okay.
If we get a booster shot after September, if we had Pfizer earlier, should we get Moderna later? Does it make a difference?
I heard, yeah, good question. So right now they're recommending you get the same one as before, but they said if you end up going to the doctor and they don't have that one, it's okay to get the other. So, but they are recommended to get the same one before. The only question is with the Johnson & Johnson, they're not really recommended a booster dose with Johnson & Johnson. Right now, we think probably getting a Pfizer is a better idea just based on some data out of England.
Was that it? The protocol. What is the protocol if a doctor or dentist have a somebody in the office has COVID? What's the protocol for that?
You know, if you're exposed, which means you're within 6 feet for 15 minutes or more, then they're supposed to notify you and let you know to get tested. So that's the current protocol that they should be doing. But especially if it's a provider who has it and they've been in the room with you. But technically right now, docs are supposed to be wearing masks in there. I know not everybody's not doing it, but that's supposed to be what's happening.
Question. I know you and the governor often different ideologies and different information. Does that ever cause any kind of conflict?
Rolanda, I didn't quite hear the question. If you wouldn't mind repeating it for me.
The question is from Tim. His question is, he said that he understands that you and the governor have a lot of conversations and meetings together, and he wants to know, do you all always agree, or do y'all conflict in meetings and agreements to COVID-19?
You know, I think that we agree in a lot of things, and I think that we agree that we have a different mission than he does, right? So we will try to 100% align with prevention, and are very pleased to see that CDC guidance is really pretty strong and evidence-based right now. So we are aligning ourselves with CDC. But, you know, I think the difference sometimes gets is between recommendation and mandates. And so mostly what we do is we do recommendations and we do guidance because we know it's the safest thing to do. But we don't mandate anything outside of areas of our direct control. Like, you know, we have regulatory control over hospitals and nursing homes. So we do, as a matter of our obligation, do things to make sure that those areas are safe. But for the general public, it's really, you know, kind of up to the elected leaders. And so we give guidance. And then the governor has to decide how much he wants to, you know, push that into the mandate format. That's not really happening right now, as you've observed. But obviously before, last year, he did the mandates on like this masks in schools and stuff like that.
All right. I just have I guess kind of what are your personal thoughts kind of question. What do you think? Do you think our schools are going to remain open for the rest of the year for the kids since the numbers are rising?
You know, boy, that's tough. So many of, you know, this is one of the things that's really sad because I think, you know, we have pretty good guidance for schools to operate. And I think if schools were able to follow the guidance strictly, I think we would have very few school closures. But because a noisy minority of very angry people has sort of taken over the conversation sometimes, to be very clear about the mask situation, I know that's become sort of a difficult thing. Mask mandates in the public probably have very limited impact. You know, like if, like, say like for a whole town or something, just because most of the times people catch COVID in places where they don't wear a mask anyway, at home, you know, dinner with their friends, you know, eating dinner with your friends at a bar or whatever. And so, you know, that's not really worth probably the fight of it, although there is probably some partial benefit for sure, and I always do it. But in the schools, without a doubt, there is phenomenal protection for those kids at those desks in those classrooms if they're wearing masks. It's unequivocal. And if we wanted to keep kids in classes more effectively, we would just have to say this is the best way to do it. You know, it seems like it's mostly the parents who are upset about it, almost and they're using the kids as a proxy sometimes. But it works. It absolutely works. We have multiple lines of data that shows that it works. It's far more important than spacing kids out. But the other challenge is even if you do that, you got to be prepared to be safe in the locker room, in the bus, in the choir room. And that's where a lot of our vulnerabilities were last year. We didn't have hardly any transmission in the classroom when we had the universal mask requirement. But we're seeing a lot. We have 20,000 kids on quarantine right now. We just started school. So we're going to see a lot of schools close down. And what you're seeing is a lot of schools change gears and saying, hey, the kids need to wear masks in the classroom, because it does make a difference. I mean, it just does. I mean, I know a lot of people are upset about it, but I can't help it. It does help. It does work pretty well.
Okay. All right. We have Dr. Dobbs for 1 minute. Anybody has a question before he?
don't have a question, but you have a statement. Over this past year, Dr. Dobbs, I found you the voice of reason. And I've heard on media and, from the medical community in the state of Mississippi. I very much value what you tell us, and I appreciate all your efforts.
No, thank y'all for that. And just know that it's really our job just to try to keep people safe and to survive the pandemic. I know it's easier for people to, ascribe nefarious motives out of, the conspiratorial nature of the world we're living in. But it's all our job is try to help people survive and be healthy. And that's it. And we will continue to do that. Understanding that there are clear personal freedoms in a lot of lanes. That's the beauty of American democracy. But clearly, science shows ways to do things safer. And so we'll try to promote things that are safer and maximize freedom for everyone by keeping us safe and not having to do crazy stuff like lockdowns and things like that. But thank you very much. I appreciate that.
Thank you, and thanks for meeting with us today.
That was great to see y'all.
Same here. Have a great one.
Bye, y'all.
Bye.